Namaskar and welcome to Sunset Television. I am Vishal Dahiya and you're watching our show, The Global Debate. This week in Global Debate, we're going to take up the issue of COVID vaccine for all in 2022. Now, amidst the global surge in Omicron variant-induced COVID infections, WHO chief in his first briefing of 2022 has repeated the long-standing call for vaccine equity and solidarity to defeat the pandemic, now reaching into its third year. WHO has been advocating for countries to vaccinate 70% of their population by the middle of 2022. WHO chief has warned that at the current pace, 109 countries could miss the target of this particular vaccination. Now, the 70% coverage target by mid-2022 is driven by the health and economic imperatives of stopping the pandemic as rapidly as possible, supported by technical analysis on disease epidemiology and vaccine attributes and a feasibility assessment that includes requirements on global vaccine production and national absorption capacities as well. So where do we stand on this? What all has been done so far and what should be the plan to achieve the target of a COVID vaccine for all in 2022. For more on this, we're joined by a distinguished panel of experts from across the globe. Let me first introduce them to you, beginning with Dr.Angelique Coetzee is joining us. She is the chairperson of South African Medical Association. We're also joined by Mr. Krishna Udayakumar, Associate Director, Innovation at Duke Global Health Institute in the Duke University, North Carolina. We also have with us Dr. K. Reddy, President of Public Health Foundation of India. Welcome, all of you, to Sunset Television. Let me begin with you, Dr. Coetzee, and let's first start by taking stock of the situation on the ground as well, vis-a-vis the surge in infection, and also the fact which we need to understand as to what role does the vaccines have to play at this stage in this battle against a COVID pandemic?
Good afternoon from South Africa, and thank you for asking our opinion and be on this show of yours tonight. If we look at the vaccines, it is extremely important to try to get vaccines in each and every arm out there, especially for people who have never been vaccinated before. With the boosters, is extremely important, especially your over 50 years old patients who has other comorbidities, and comorbidities would mean hypertension, diabetes, overweight, or any other disease. And then your younger people who also have certain diseases that might compromise the immune system. The children, that's a very interesting debate. In South Africa, we're trying to vaccinate children 12 years and older. We need to also understand that the younger children still have a very good or robust immune system comparing with adults above the age of 60, whose immune system are not so good anymore than that of the younger people. If we then look at what is the role of the vaccines, it is clear that the vaccines are helping a lot, whether it's Delta, whether it's Omicron, with hospitalization against severe disease, and also those people who have been vaccinated getting severe disease, their chances of dying are much less than the unvaccinated people. So there's definitely a huge role to play with vaccines, but it is difficult. There is inequity around vaccines, and we need to understand that even if you are vaccinated, you can still get mild disease. Okay. And the reason why it's important to tell this to the public is that you do not get expectations that you are, once if you are vaccinated, that you will never get sick or never get a mild disease, or that you are now safe. You are only as safe as your own personal behavior as well. You are safe, much more safer, if you have been vaccinated, wearing your masks, listen to the non-pharmaceutical interventions that we also are urging you to do. That's for me,
Okay.
extremely important to get this message out.
Okay, indeed, that is the most important message, Dr. Coetzee out there, pointing out clearly that as far as vaccines are concerned, specifically with respect to COVID-19, they provide you an additional safety net, but that doesn't mean that you can, lower your guard with the precautionary measures which have to be taken in terms of wearing a mask, maintaining physical distancing, and washing your hands regularly as well. Let me bring in Mr. Krishna Udayakumar as well. Mr. Udayakumar, from your perspective, if we have to understand how feasible is this target which has been set of achieving 70% vaccination globally by the mid of 2022, and going by the pace of vaccination, as WHO chief was pointing out, looks like 100 odd countries are going to miss the target.
Yes, first, thanks for the opportunity to join you today. This is really the critical topic for the coming months, is how quickly can we vaccinate the world. Full agreement with everything Dr. Coetzee just pointed out. And we are currently not on track to vaccinate anything close to 70% of every country by the middle of this year. If we look, there was an interim target set by the World Health Organization, endorsed by the G20, of 40% vaccination by the end of December, and more than 70 countries missed that mark. And if you look at the AMC COVAX countries, those 92 countries that are low and lower middle income, most of those countries, including most countries in Africa, didn't hit that 40% target. In fact, the median percent by the end of December was closer to 20% than 40%. So we have a long way to go. The good news is the supply is finally starting to pick up. We've administered now more than 9 billion doses of vaccine around the world. We have almost 10 safe and effective vaccines that have been authorized by the World Health Organization or one of the stringent regulatory authorities around the world to be used. We're now producing more than 1 billion, perhaps 1.5 billion doses of vaccine every single month. There are still supply challenges. It's less now about total global supply and much more about equitable allocation. We're seeing more high-income countries using more doses for third shots and fourth shots for boosters than we are primary vaccination in low-income countries. So there's still a significant supply challenge for most low and lower middle-income countries around the world. As that gets better over the coming months, we're in fact going to enter the second and perhaps even more challenging phase of this, which is getting shots from airports to arms. Everything that's needed in terms of the political commitment, the funding within the countries, the workforce, the data systems are all going to be extremely challenging in most countries around the world. So we should have global targets. We should adapt those to the local context and recognize that we have much more work to do if we're going to try to achieve those targets.
Okay. Fair enough. Global targets will have to be adopted at regional levels, at national levels as well, and the national absorption capacities will also have to be utilized to the maximum level, as you're pointing out. Let me bring in Professor Reddy here as well. Professor Reddy, as Mr. Udayakumar was pointing out, the supply seems to be, at a comfortable pace right now, although there are certain challenges when we talk about the supply chain of COVID vaccines. But to achieve the target of 70% vaccination globally, we would need around 11 billion doses. And that seemingly won't be a difficult target in terms of supplying that particular number of vaccine. Now, the question here is that in terms of ensuring vaccine equity globally, what is it that needs to be done correctly and in a proper manner?
Well, I think it's been very clearly recognized that if you have great disparities in vaccination globally, you are giving an opportunity for new variants to emerge with possibly even greater capacity for vaccine evasion or escape. And those vaccine-rich countries, which are giving the third or fourth shots, will actually suffer because the variants will come back to haunt them. And it is that realization that must guide, that is enlightened self-interest, apart from ennobling altruism, which actually ought to be really the background of global solidarity in meeting a pandemic together. I believe the vaccines that are currently available can be scaled up in production. There are new vaccines which are also coming into the pipeline, going through trials and possibly even more effective against some of the recent variants. But one of the lessons that has clearly emerged is that you cannot depend upon global supply chains to reliably meet the vaccine requirements of all countries in the world, not just in terms of quantity, but in terms of overcoming vaccine nationalism and selfishness. And therefore, you must have distributed production capacity across the world. Different low and middle income countries must be assisted and supported in developing that capacity. And that's where South Africa and India actually introduced at the World Trade Organization a resolution asking for complete waiver of patent protection for any COVID-related vaccines, drugs, and technologies that is still being debated even of this date. So this is where I believe we must ensure vaccine equity within countries as well as across countries.
Okay, fair. That also is a very important point which you're making, Professor Reddy, that vaccine equity within the country and across the globe as well will have to be stressed upon. Vaccine nationalism is something which is not going to do us any good in this battle against the pandemic. Dr. Coetzee, I'd like to bring you in here. And since you've been dealing with the COVID patients on the front line out there, one more interesting aspect which I would like you to explain to our viewers. Vaccines do give us an edge, a much needed edge over the COVID infection. But the efficacy of vaccines, and when we are talking about new variants coming out, for example, Omicron is the latest one.
Yeah, so if you look, very good question. So if you look at the data, especially what that came from Johnson & Johnson, remember in South Africa, we have Johnson & Johnson and Pfizer. So if I speak about vaccines, this is the experience we have. We don't have the other vaccines. And I also think it is important to understand that the vaccine is being used in your country, how well it's been tested against some of these variants and what are the efficacy of these vaccines. But if you look at Johnson & Johnson, clearly about 87% efficacy against severe disease. However, both Johnson & Johnson and Pfizer, low efficacy against mild disease. But what we have seen, a clinically experienced, so this is now lab and scientists' data from at the background, but what we are seeing and experiencing is that with mild disease, whether you're vaccinated or not, if you look at the numbers that we are seeing in private sector, it's more or less equal. However, those patients that's been vaccinated, their symptoms are less intense. They experience the pain or the whatever the clinical symptoms they have, not as intense as your unvaccinated people. I think it's extremely important to understand that. So when you get the headache, they will get a headache. If you're unvaccinated, you will get a mother of all headaches. So there's definitely a difference between the two. Okay. However, with the vaccines regarding severity, if we look at the efficacy of that in ICU, 88% from some of the data that we have are unvaccinated people. So there's definitely you cannot say, but everyone is getting, even if you have been vaccinated, you still get COVID. Yes, you still get COVID. We never say you're not going to get COVID, but it's important to understand your risks if you've been vaccinated versus unvaccinated people.
Okay, indeed. That's a very, very important difference out there. Professor Reddy, your views there on this, efficacy aspect vis-a-vis the new variants, because you were earlier pointing out how, the vaccines are going to give us an edge and, those countries which are lagging behind in terms of vaccination will feel the pinch of newer variants out there.
Well, we know that all the vaccines do confer a certain level of protection against severe disease, hospitalization, and death. Some of that efficiency may actually decrease with some of the new variants, but it's not totally lost. There is still a fair amount of protection to be gained. And if we do get new vaccines with a greater level of efficacy because they are specially customized for the variants, that will help. But I think the most important thing is to ensure that everybody, especially the vulnerable people, are adequately protected with complete vaccination with whatever vaccines are available, and at the same time reduce the population threat of speedy transmission by ensuring that people wear masks, do not crowd in large numbers, and preferably move in well-ventilated spaces. Therefore, we have to use masks against mutant attacks and vaccines against variant disease.
Okay, so masks against mutant attacks and vaccines against the variant disease. Obviously, that is a very clear definition out there in terms of what needs to be done as far as the battle against COVID pandemic is concerned. Coming back to the issue of vaccine equity, and Mr. Udayakumar, I'd like to bring you in here. To achieve that target, which we were earlier talking about in the first round, the 70%, obviously the larger target and then the better target would be achieve 100% vaccination. But first we have to cross that 70% mark. What is it that needs to be done, not only by the nations, but by also global organizations, including the WHO and the vaccine platforms as well, which are there?
Yeah, as I mentioned before, much work still remains to be done. First, as both Dr. Reddy and Dr. Coetzee have said, we have to put a better context of the role of vaccines and vaccinations to ensure that they are helping to protect both individuals against severe disease, but high levels of vaccinations coupled to a layered public health strategy can also ensure that we're protecting our health systems and keeping our economies going. In that context, the ways to continue to increase vaccination are both to work on the supply in terms of ensuring that we have more transparent and equitable access to vaccines all around the world. And then on the demand side, to make sure that we are investing in the infrastructure to ensure effective and efficient vaccine distribution and delivery. And at the end of the day, we need to not forget about vaccine hesitancy and vaccine confidence, which is going to eventually determine the level of vaccinations that each country gets to. Right now, in most countries around the world, it's not vaccine hesitancy that's driving a lack of vaccination, but that will come into play down the road. In all of this, we have to recognize that we have not committed, mostly from high-income countries, donor countries, nearly enough money to make this all feasible. The ACT Accelerator, the consortium led by the World Health Organization, attempting to bring together a global coordinated response, has proposed a budget of about $23 billion to get through the next 12 months or so, of which less than $1 billion has actually even been committed to date. So we're 2 years into the pandemic and still going hand in hand to hope that people may look charitably at being able to fund what's needed, especially the vaccine distribution and delivery needs of most countries. As Dr. Reddy pointed out, we need to shift the mindset that this is about self-interest. Yes, it's a humanitarian disaster. Yes, we should do this because it's morally the right thing to do and ethically the right thing to do. But every country, including the US, including every high-income country, has a self-interest to ensure that their population health is protected, that their economy is protected by making sure we're vaccinating the world. And so we need stronger institutions, including the World Health Organization, and we need significant funding to be committed by those who hold the resources to make this all feasible.
Okay. Dr. Coetzee, do you agree with that part there that the developed countries need to push a little more further in terms of both funding and efforts as well, so that others, more specifically the low-income countries, can go ahead and ensure that their population or their citizens are vaccinated in time to reach that target, to enable all of us globally that we bring this pandemic to an end in this year itself? Dr. Coetzee?
Sorry, was this directed at me?
Yes, Dr. Coetzee.
Okay, thanks. Sorry. Yes, I think there's two things that one needs to understand. First of all, it's the cost of the vaccine to the government. The second thing is and Krishna mentioned this, the distribution or the cold chain of these vaccines. And you need to understand it is not that easy in Africa or in your low income countries, especially where there are vast rural areas. To get these vaccines to the people who need it is quite a logistical challenge. And so you can give Africa a lot of vaccines. You can give them Moderna as much as you want. It's a beautiful vaccine. But do we have the infrastructure to actually administer this in time before the expiry date are there? This is the type of thing. So it's not only about giving the vaccines to the poorer countries, but how do we assist and make sure, to just reconstruct a vial with put your saline in and then draw up with a specific needle, a tiny bit of that fluid, getting that fluid to be cold, getting it into an arm, might be very simple in a first world country, but might be a huge challenge in a third world country. Mm-hmm. So we also need to look at the form in which we administer these vaccines going forward. Because you can give us as much vaccines as you want, but if I can't get it from point A to point B to where it's needed, it's not going to help and assist us.
Okay. That's really important out there. Professor Reddy, quick concluding comment from you on this aspect, which Dr. Coetzee is pointing out, and the aspect specifically of doing more by the developed countries, by the rich nations, and not only in terms of funds, but as Dr. Coetzee is saying, in terms of putting the infrastructure also in place, just giving the vaccines away to the low-income countries might not be enough.
Absolutely right. I think we must ensure that when we are talking about global health, we are not talking in silos or segments. We do need infrastructure. We need supplies, equipment, but we also need the human resources. We need people who are public health experts, but also people who are frontline health workers who can actually distribute the vaccines, deliver, particularly primary health care. That's an absolute priority. And that's been long neglected in many countries, which are under-resourced. Mm-hmm. And even the human resources that are being produced by low and middle income countries are often taken away into the high income countries. There's a fair amount of human resource drain, which is not compensated in any way. So if the world wants a healthier globe rather than a healthy suburb in the New York City, then they have to definitely invest in strengthening the health systems across the world, which means infrastructure, human resources who are well-trained, a multi-level, multi-skilled health workforce, and also then in equipment and supplies. Okay. All these three things go together. You may have the best of infrastructure, the best of digital technologies, but without an adequate health workforce, you will have a carriage without wheels. So you need to put all of them together, and that is a global conjoint responsibility. And no longer is an infection going to be confined to a single household or a single village. It's going to spread across the countries, and therefore it has to be a combined effort.
Indeed, and we've seen how quickly it spreads across the globe. As far as COVID vaccine is concerned, various variants which we have looked at. Thank you so much, Professor Reddy, Dr. Coetzee, as well as Mr. Udayakumar for sharing your views and insight with us and our viewers. As our experts were pointing out, clearly the battle against COVID-19 pandemic has to be fought at multiple levels, and one of them is with vaccine equity, ensuring that everybody across the globe gets vaccinated against COVID. The target is 70% by the mid of 2022. We're lagging behind, but as our experts were pointing out, some tweaks in the policy, some more efforts being put in by the developed countries or the rich nations, not only in providing vaccines, but also in ensuring that infrastructure is put in place in low-income countries and others who need it as well. We'll come back again next week with a different topic. Till then, keep watching Sunset Television. Thank you.